Hello and welcome to the Contraceptives lecture. Okay, now keep in mind the term contraception means before conception, so before sperm and egg meet. Birth control is more of a broad term. Birth control is anything that prevents a live birth. So as an example, abortion is not considered contraception, but abortion is considered to be birth control. And we're not going to cover abortion today. We're just going to really focus on the contraceptives. Okay, Guttmacher has done a lot for women's health. No woman is completely free unless she's wholly capable of controlling her fertility, and no baby receives its full birthright unless it's born gleefully wanted by its parents. I think about this and I think about my own lifetime. I've got two grown sons who very much were wanted. I spent only 6 months of my entire life trying to get pregnant and the rest of the time trying not to become pregnant. Just because you can reproduce doesn't mean you should. Okay, let's take a look at statistics in the United States. 48% of pregnancies are unintended. And I know it's going to hurt some of your feelings in this class because many of you are going to be like, was I not planned? Was I one of that nearly 50%? Unplanned pregnancies are more likely to occur in the early 20s. We know that higher income women are less likely to have an unintended pregnancy, and low-income women are 4 times higher likelihood of having an unintended pregnancy than lower income women. I know that in some of the local rural high schools, as an example, where they do have sex education and they give some of these teenagers information on how to prevent pregnancy, it is interesting with these low income, very rural, not going to college, not going to community college gals, how some of them think about like their destiny in life is to become a mom. And many of them, which blew my mind when I realized this, are actually trying to get pregnant in high school because it's sort of like, if motherhood's going to be my end all in life, I might as well get started on it. It's a very different kind of attitude than individuals and women. We know that women with at least some college education have half an unintended pregnancy rate as those compared to women who are high school only. And certainly, I think you all know that individuals who, particularly if they get married or they get pregnant in high school, very different than individuals who go on to an education. Certainly, this is a very political issue. My body, my choice, your money, and then you've got over here, you want me to give you hard-earned money so you can have sex. And again, that's directed at women and not necessarily directed so much at men. So if you can be exempted from method of birth control since you're morally opposed to it, can I be exempted from having my taxes pay for war, which I'm morally opposed to? So kind of getting at some of the heart of the political issues here. No birth control, no Viagra. After all, impotence is a sign from God that old men shouldn't be having sex. Therefore, using Viagra goes against what God wants. This is getting at some of the morality for contraception. I called to thank the GOP for still allowing insurance to cover my husband's Viagra while I pay full price for birth control to treat my cysts. So again, kind of snarky stuff getting at some of the political issues that we have. Susie and Nader had to try. If you've got insurance, then you can get physical because you can afford birth control with your insurance. Okay, contraceptive efficacy. So let's talk about what works the best. And then this is oftentimes broken down into absolutely perfect use and how effective that is versus real human behavior, which would be called typical use. So as an example, perfect use would be if you're on the pill, taking the pill at exactly the same time every single day. Typical use would be, forgot it on Saturday, took 2 pills on Sunday type of thing. Okay. So if we know that conception takes place in the fallopian tube, so you've got sperm gets ejaculated into the vagina, it travels up in the cervix into the uterus, the sperm travel up into the fallopian tube. If the ovary has released an egg and that egg gets released and goes into the fallopian tube, that is where conception takes place. And then after conception, what happens is that embryo, now sperm and egg have formed an embryo, travels down, ideally travels down the fallopian tube and then embeds somewhere in the uterine lining. And then the uterine lining that would be shed monthly for a woman's menstrual period, that uterine lining becomes the placenta that ends up nourishing and feeding and protecting the baby. Okay. So contraception would be anything that prevents that uniting of the sperm and the egg in the fallopian tubes, and so preventing pregnancy. We know that fertilization and implantation is most likely to happen, that conception is going to happen if there's fresh sperm available in the upper reproductive tract when ovulation occurs. And the egg can live for a half a day up to 1 full day, but the sperm is viable for 72 hours. So depending on when sex occurs, there's approximately conception can be documented if intercourse occurred 6 days prior to ovulation or 3 days after ovulation. So most women with normal menstrual periods are fertile about 9 days a month, and then they tend to be infertile the rest of the days of the month. People who follow the rhythm method tend to try to plan their sex in those other days that are not these 9 days. Okay. So contraceptions can be easily divided into 2 simple categories. And the simple categories are the hormonal types that are going to be hormonal in nature and preventing ovulation in women, and then the non-hormonal types that are also called the barrier methods. And so the hormonal types would be oral contraceptives, what we consider to be hormonal emergency contraceptives. So that would be used if there has been no contraception and then there's been intercourse. A woman would take that afterwards to try to prevent conception in an emergency situation. The injectables like Depo-Provera, the implants, IUDs, which are intrauterine devices, intravaginal ring, and transdermal patch. We're going to cover all of these. Non-hormonal or barrier methods would be things like IUD, the lactational method, which would be when a woman, after she's had a baby, if she full-time nurses and full-time feeds her baby from nursing with breast milk, most women are infertile for about 6 months after birth if they're lactating. Now, if they're not nursing their baby full-time, then they could be ovulating and could get pregnant. So that affords women about 6 months of contraception. Many women, after the birth of the baby, even if they're lactating, though, will ask their doctor to put them back on some kind of form of contraception, or they will use a barrier method. The diaphragm or the cervical cap, if used with spermicides, we'll talk about that, the withdrawal method, and then periodic abstinence. So periodic abstinence would be that rhythm method that we talked about, where women are trying not to engage in intercourse in those 9 days where they could be fertile, or they're using some other method like a diaphragm, or they're using condoms or something like that during those 9 days, and then maybe not using stuff at the other time. Okay, the pill. This has been an absolute amazing invention for women. And one of the things that we know that the pill does, and so a lot of women, when they have really heavy periods, or they have a lot of cramping, or they have a lot of PMS, will go on oral contraception, the pill, even if they don't need it for pregnancy prevention, because it reduces the amount of flow in their menstrual periods. It reduces cramping. A lot of women take it for treatment for acne. There's all kinds of different uses that are beyond just using the pill for pregnancy prevention. And what we know that the oral contraceptive does is it prevents luteinizing hormone, that surge that stimulates luteinizing hormone, and then after that, follicle stimulating hormone that would stimulate ovulation and make an egg come out and go down the fallopian tubes. And so basically what happens when a woman is on the pill, which is usually a combination of estrogen and progesterone, it tricks the body into thinking it's already pregnant. And if the body's already pregnant, she's not going to be ovulating and therefore cannot get pregnant. So it's mimicking pregnancy. And put simply, a woman tends to ovulate 1 egg a month. Now, some women ovulate more than 1 egg a month, particularly as they age, which is why older women, when they get pregnant, are more likely to have twins or triplets. Also, older women might be using some kind of fertility medication to deliberately stimulate more ovulation if they're struggling to get pregnant when they're older. But most women ovulate 1 egg a month. And put simply, I wish we had more options for male birth control, but it is easier to stop 1 egg from happening than it is to stop millions of sperm during an episode of intercourse. When the placebo pill, so usually women will take, it'll be about 21 days of the actual hormone. And then in the pill pack, there tends to be 1 week of placebo pills, sugar pills. And some women, take them and some women just dump them in the trash. But it's when they stop taking the actual hormones, then that allows for them to have a menstrual period. Now, keep in mind, a lot of women nowadays are choosing not to take the placebo pills. They're staying on the hormone beyond 1 month just to prevent periods. And most OBGYNs will say that it's perfectly safe to do so. A lot of women do that just out of convenience. They don't want to have any periods. And if you don't need to make a placenta for a baby, you don't need to necessarily renew the uterine lining, which is what's shed during a menstrual period. And so a lot of women are doing that just out of convenience. Some women will go, because a lot of women start spotting, like let's say they've gone several months and not allowed for a period because of their oral contraceptive. A lot of women start spotting. And then that's kind of like the thing that a lot of women are like, okay, I need to do placebo for 7 days or not take any hormone for 7 days and let my body go ahead and have a period. Okay, it's perfectly safe to do that. Lots of advantages of oral contraceptives. Decreased menstrual blood loss. That's particularly important for women who have issues with anemia when they are losing a lot of blood during their menstrual period. Women who have fibroids, which are these harmless tumors inside their uterine lining, tend to bleed more. Women with endometriosis tend to bleed more. Decrease in the menstrual cramps and pain. A lot of women like being on the pill because it's a predictable period. They know when it's going to be coming because you can, once they go into the placebo or they stop taking the hormones, they can predict it within a couple of days they're going to start their period. A lot of women will plan their pill pack so that their weekends are free from periods so that they have their menstrual period during the week because more individuals are engaging in intercourse on weekends. For women who have a lot of ovulation pain, it eliminates that pain because they're not ovulating. Women who have polycystic ovarian syndrome, a lot of women will take the pill because it helps them manage those abnormal hormones. Women with PCOS tend to produce abnormal levels of testosterone. And so this replaces the progesterone and the estrogen and helps balance out those ratios of the female hormones relative to the testosterone, the male hormone. Keep in mind, women do have testosterone, just not as much as men. It reduces risk of endometrial and ovarian cancers. The old pill, the pill that if your grandmothers were on the pill or my mother's generation, that used to have much more hormone than the pill nowadays that has very low levels of hormone. And it used to be that women had many more side effects, including really high risk side effects like blood clots. And there tended to be a lot of weight gain in the old version of the pill. Nowadays, it's very, very minimal weight gain. For women with anemia, because of that heavy blood loss, it reduces that. A lot of women take it to reduce acne. And then dysmenorrhea is really painful menstrual cramps. And again, it tends to help women, less blood loss, less cramping, less pain. Other advantages, absolutely no preparation needed in order to have coitus or intercourse, to have sex. Lower risk of tubal pregnancies, a quick return to fertility. So after women, if they decide they want to try to get pregnant and they stop taking the pill, they will resume ovulation, usually within 1 to 3 months. And again, a lot of women are skipping the placebo pills and skipping their periods and enjoying that convenience. Disadvantages. A little bit of spotting, which would be really light blood flow. You women in this class are going to know what spotting is. You guys might not. Particularly in the first few cycles, so for the first couple of months, sometimes women will spot before a period is due, especially if there's inconsistent use. Women tend to have scant or missed periods, but a lot of women appreciate that. Some women will experience a decrease in libido, which is their sex drive, and some women will have some mood changes. It does have some effect on some of the neurotransmitter substances in the brain. I love this. Why are there never any good side effects? Just once, I'd like to read a medication bottle that says may cause extreme sexiness. Okay. You've got to take it daily around the same time each day. And again, there's such low dose nowadays. If a woman misses a pill, there's the possibility of misses a day or takes it at weird times and different days, then she could accidentally ovulate and then get pregnant with that. Also, no, I don't have this on the PowerPoint slide, but we've got to be careful when women, I used to work in a pharmacy as a pharmacy tech when I was in high school and college. When women take an antibiotic on top of the pill, oftentimes that antibiotic makes the pill not work. And the reason for that is that bacteria in the gut help take the hormone when it's digested after a woman swallows it and get it into the bloodstream. So normal bacteria works as a carrier mechanism in the GI tract. And when women are on antibiotics, it tends to kill the bacteria in their gut. And then that bacteria is not there to help transport the hormone into the bloodstream. So the hormone might just go out through the urine and the woman might not have adequate amount of the hormone to mimic pregnancy. And so a lot of times women are warned when they're given an antibiotic on top of the pill. Women who smoke absolutely should not be taking oral contraceptives because there are very high risks for cardiovascular, blood clots, stroke, heart attacks. And so they are advised to quit if that's the form of contraception they would like. Effectiveness, perfect use, the failure rate's only 0.3%. And so it's really, really effective if taking as it's supposed to be, again, every day, same time of day, but typical use, the failure rate's about 9%. Improvements over time. These are some of the brand names. They've kind of manipulated the hormone over time. This Yaz as an example, and then low estrogen, these are some of the brand names. Some of the lower estrogen doses, these are some of the brand names. And then women have been, and OBGYNs and midwives have been prescribing extended hormone to skip menstrual periods for years. They've just been doing it, but now there's some brand names that have come out to try to make money. Seasonal, Seasonique, Liberal, those kind of liberal. You're just so liberated. And then also, there's more options nowadays for emergency contraception. So that would be a woman who's not using contraception, who, let's say, ends up having intercourse, maybe with a boyfriend, or when women are raped, they are oftentimes given, if they're not on some kind of contraceptive, they're given an emergency contraceptive, as well as STD screening after rape if they obtain medical care, to make sure that they don't get pregnant from the rape. It's much less dangerous than the heavy hormone doses in previous generations. So we've come a long, long way with that. Side effects. Some of these side effects are the side effects that a woman would have during pregnancy. Again, because the hormones are kind of mimicking pregnancy to prevent pregnancy. So some of them are like that. Some of them are different. Some women have nausea, some women have nausea and vomiting, which some women have that with morning sickness with pregnancy, so that makes a little sense. Headaches, a sense of bloating and holding water, or bloating in the abdomen, kind of bloating, feeling like the uterus is kind of full of water, that type of thing. Again, you women in this class are going to know what bloating feels like. You guys might not. That decrease in sex drive, the mood changes. Some women experience some dizziness because they experience changes in blood pressure. Some women do experience weight gain. And for some women, that's a reason why they choose not to take the pill. That fluid retention or edema, the spotting, which would be the mild bleeding. Breast tenderness, again, breasts get real tender during early pregnancy. It's mimicking pregnancy. Leg pain and high blood pressure. The danger of blood clots, we call this aches, and this would be, again, this is a lot more likely to happen in women who smoke, who take the oral contraceptives. But if there's a very strong history of cardiovascular disease, some women are recommended that they do something else. So this would be abdominal pain, chest pain, headaches, severe headaches, eye changes, severe and sudden, and severe leg pain. This is a medical emergency. It's a blood clots. Okay, so enough with the pill. Now let's talk about the Nuvaring. And again, there's so many more options for contraception nowadays in your young women's generation than there was in my young women's generation. The Nuvaring is not a biodegradable. It's a flexible, transparent vaginal ring. And you can see here, it's got some tension to it. And so a woman is able, what she does is she squishes it and she inserts it into the vagina. And then you can see it goes up and hangs out near the cervix or around the cervix. And this is hormonal, but it is doing local hormones. So the pill would be systemic hormone because you're taking it orally. So it's all throughout your bloodstream. This is delivering the hormone right into the area to prevent ovulation in the area by the uterus. It's going to release a estrogen over a 3-week period and prevent ovulation. There's no fluctuation in daily hormone levels because they're not taking like the pill systemically. Better withdrawal spotting pattern. So there's less spotting than women who are taking oral contraceptives. Lower levels throughout the bloodstream of estrogen and progesterone. Again, if it's taken orally, it's going to be all over in the bloodstream if it's just local. It's private, very little waking. They've got to be comfortable inserting it into the vagina. For women who've been using tampons throughout their young 20s, there's usually no problem with that. They've been inserting stuff into their vagina forever. Client must remember when to take it out. Some kind of marker on their calendar. So they have it in for 3 weeks and then they take it out for a week to have a menstrual period. Sometimes it falls out and they can tell, you can feel it when it falls out. It's kind of like a tampon, not a slip, and they just go pop it back in. Some women, their partner can feel it during intercourse. And so a lot of women will remove it right before intercourse, have intercourse, and then put it back in. And that still affords them good contraception. Sometimes there's withdrawal bleeding beyond the ring-free interval. So sometimes there's a little spotting kind of stuff like women can get on oral contraceptives. The effectiveness is the same as oral contraceptives, although there's no typical use failure rate noted. It's likely since the method is used once per month rather than daily, the typical failure rate's probably lower than oral contraceptives. So again, a once a month insertion versus a once a day pill. The transdermal contraceptive patch application, it's tiny. It's got 3 layers, release liner removed at the moment of application, medication adhesive layer, and an outer protective polyester layer, and then medication that seeps into the skin. It's usually applied to the buttocks, the upper arm like this gal has, lower abdomen or upper torso, but not on the breasts. Some of the advantages, it's a weekly application. And so again, better than having to take a pill every day. You can easily verify it's there and go check the patch. Doesn't require any vaginal insertion. It's rapidly reversible for women who want contraception through the patch and then they want to get pregnant. And excellent cycle control after 3 months. Some disadvantages, some women get some irritation around the site, so little reactions there. It's not as effective for larger women. So women that are about 200 pounds or over, it's just not enough hormone in there. Side effects are pretty similar to oral contraceptives, but there's more breast pain for women and breast tenderness on the patch, and then higher rates of menstrual cramping. It can be difficult to conceal. So women who like to wear sleeveless kind of shirts, if that's where they like to keep it, then it's obvious that they've got this patch on, and no protection against STIs. And that's the case for a lot of these. Some of the progesterone only methods, there are some progesterone only pills. So women who cannot tolerate estrogen, or women who have A genetic tendency for estrogen-driven cancers, like the BRCA genes for breast cancer and ovarian cancer, are oftentimes put on a progesterone-only pill and not an estrogen-progesterone pill. They are not quite as effective, and so there's cost to it, but there are pills that women can take. There could be a Depo-Provera injection. They can do an implant. They can do emergency contraception, or they can do an IUD that actually has progesterone and emits the progesterone internally in the uterus. Advantages: decreased blood loss, less cramps, less pain. 10% of women become amenorrheic, meaning their periods actually stop, and a lot of women like that. Rapid return to fertility once this is stopped. Possible reduction of pelvic inflammatory disease because of some cervical mucus thickening, which would prevent a sexually transmitted infection from traveling and getting through the cervix up into the uterus, because mucus is pretty sticky and thick there, and can be used for smokers and women over the age of 35. So women that have these other risk factors, and can be used in breastfeeding women without stopping the milk when they want a little extra protection beyond the breastfeeding, or particularly if they're breastfeeding beyond 6 months and they've lost the lactation protection. Some disadvantages: irregular periods may be associated with more ovarian follicles and cysts. They must take the pill at the same time every day, and that's very important. Again, similar to the progesterone and estrogen. And some women just have some really gnarly mood side effects from progesterone only, like depression, anxiety, feeling irritable, feeling tired. So it's not a good fit for everyone. Some of the single rod implants. So again, hormonal here. Nexplanon. It's very, very effective. Failure rate almost 0. Number of pregnancies expected per 100, less than 1%. And it lasts for, you get this thing inserted, it lasts for 3 years, which is very long term. It can be inserted at any time, including right after a woman has a baby, as long as she is certain she doesn't want to become pregnant. For some women, the problem with this is they get a lot of irregular bleeding. And for some women, they get a lot of cramping. And so or a little bit of pain after insertion. So some women will take some kind of NSAIDs like Motrin or Aleve for a couple of days. And again, it's hormonal. Emergency contraception. We have seen 43% decrease in abortions in the United States in the last 5 years. That has been directly attributed to women being able to have access to emergency contraception. So again, following a rape, following an unexpected consensual intercourse, women can go and buy over-the-counter something like Plan B, take that. The sooner the better after intercourse. This is offered up in emergency departments for women who have been sexually assaulted. But it makes a big difference when women don't want to get pregnant and they've had unplanned intercourse and are at risk. The ability to get emergency contraception has made a huge difference. And we think we've prevented about 51,000 unplanned pregnancies just because of having this. So this is really a nice medical miracle for a lot of women. It inhibits ovulation, decreases the probability of fertilization after ovulation. So if she has ovulated, more likely to prevent that from happening. It decreases the likelihood of implantation. The environment is not as hospitable for an embryo. And it does not interfere with an established post-implantation pregnancy. So lots of advantages here. Again, most effective within 72 hours, sooner the better. Can be given up to 120 hours following unprotected intercourse. And it's indicated regardless of the cycle day in which the unprotected intercourse. So they can take it anywhere in the cycle and prevent contraception, prevent conception. No contraindications, so it's safe for most women. Initiate long-term contraception immediately following. It does not prevent pregnancy for the rest of the cycle, though. So if this emergency contraception does not afford like a month worth, so it's just after unintended intercourse, but then she needs to follow up and have, if she's going to have additional intercourse, contraception, another form of contraception for the rest. There's usually resumption of a normal menstrual cycle, and again, over the counter, she can get it anywhere. Now let's switch gears and talk about Marina, which is one of the newer IUDs. It used to be the older IUDs back in my generation, like Paragard, the copper IUDs. OBGYNs would not give a woman an IUD pre-pregnancy. It was only after she had had a baby that they would insert and give a woman an IUD. And so it was not a form of birth control that a lot of women could get pre-birth of a baby. Nowadays, the Marina, they will insert and give women pre-baby making the Marina. And so it's become a very popular form of long-term birth control for a lot of women, older women and younger women. And it is inserted in through, there's a device that holds the cervix steady, and it is pushed into here, and it sits in the side the uterus, and it releases a low dose of this hormone into the uterine cavity, and it can be inserted and promising birth control for up to 5 years. So not only is it like after the doctor inserts it, it's long-term, perfect, and failure rate's only 0.1%. So it's really effective. And it's second only to sterilization in terms of birth control effectiveness. It changes the bleeding pattern. For a lot of women, just because it's in there and it's irritating the lining, it's going to create some cramping early on. The old-fashioned IUDs, again, my generation's IUDs, created very heavy periods and a lot of cramping because it was constantly irritating the lining in here. But for a lot of women, another reason why they like this IUD is, again, little cramping, more bleeding early after insertion. But a lot of women, and it may do a little spotting for a couple months, but then the bleeding oftentimes ends for women. So about 20% will become amenorrheic, meaning they stop having menstrual periods within the first year of use. And a lot of women like that. So again, it is, insertion by a doctor, less periods over time, up to 5 years. So it's no wonder this is an ideal longer-term form of birth control. Also, when women if they decide they want to try to get pregnant, you have OBGYN pull the Marina out. Keep in mind, this part flexes, and so it goes in as a tube, and then it opens up, and then when it's pulled out, it flexes back up into a tube. So it's not like this thing is like, going to be cutting her open as it's removed. After removal, she resumes oftentimes normal periods and normal ovulation quite quickly. We believe that this works. This creates a small amount of inflammation in the uterine lining. And so it makes the uterine lining inhospitable for an embryo to implant. And that's how we believe these work. The lactational amenorrhea we've already talked about. If she's breastfeeding her baby, giving her baby all of its food through her breast milk for 6 months, it provides about 98% protection. But only 71% of infants are breastfed, and only 16% are being breastfed at 1 year. And again, a lot of women, even if they're breastfeeding full-time for their baby, don't want to take the risk and usually want to use some other form of contraception on top of that, especially after 6 months. Here's my little joke. 99% condoms if used all the time, birth control 99, and Crocs, because apparently Crocs are not sexy shoes. I love buying Crocs. Make whatever joke you would like. All right, typical effectiveness. We've got less effective for these barrier methods, more effective for sterilization, the implants and the IUDs. Somewhere in the middle, we've got the pill, the patch, the ring, the diaphragm. So we've got a couple barriers, and then we've got a couple hormonal forms here. When we look at use patterns, and again, we're seeing an increase in the IUD, but a lot of women rely on the oral contraceptive, the pill. So about 50%. About 20% are using male condom. About 16% are doing one of those other hormonals. Interesting, this is the US pattern, but keep in mind worldwide, the IUD is the most popular form of birth control worldwide. It is just not the most popular form of birth control in the United States. But again, now that we've got Marina compared to the older ones, a lot of younger women are using it, and it's affording a lot more popularity. But keep in mind, per the STIs lecture and Dr. Beasley's lecture, we have not seen a decline in sexually transmitted infections. And a lot of that is because women are getting really good contraception, and they're not using a barrier method like a female or a male condom to prevent STI transmission, because their biggest concern is preventing pregnancy. And unfortunately, a lot of women are not being as concerned about sexually transmitted infections as their actual risk. Don't give up what you want most for what you want now. So this is just a caution in being careful. Again, more educated women are more likely to be using contraception and have less unintended pregnancies. Here's a joke: non-hormonal barrier methods. If the skinny jeans are so tight you can't get them off, then that would be a barrier method. Okay, abstinence. It works. It prevents pregnancies. It prevents transmission of sexually transmitted infections. And this is a Charlie Chaplin quote: "Your naked body should only belong to those who fall in love with your naked soul." Abstinence works, just not the choice that a lot of people have. Side effects of sexual abstinence may cause frustration, but that is not fatal. And then there's even been controversy over the years in sexual education about masturbation. And there are a lot of individuals who lean more liberal, more progressive. It's like, yes, masturbation is an option. A lot of people are going to be sexually abstinent at certain times in their reproductive lives, and even beyond their reproductive lives. And masturbation, having self-sex, is an option. But again, a lot of controversy over the years. A lot of that has faded generationally. Now we know masturbation, yeah, do that instead of going out and finding a sexual partner, unless you're in a longer term monogamous relationship. Okay, and then this is a slide about consent. Before you assume, there's this thing called asking, and there's certainly been in your generation much more encouraging males and females to make sure that there is consent. They ask and get an affirmation that their partner is willing to have sex with them. I know I had that talk with my sons when they were in high school, in college, making sure that if they find sexual partners and had girlfriends, that they ask. I try not to take advice on birth control from friends who get most of their advice from gossip magazines. Okay, withdrawal, coitus interruptus. I think that's a funny word, coitus interruptus. The withdrawal method, or the pull-out method, a lot of times people call this pull-out. This would be removal of the penis from the vagina and away from external genital organs, so away from the vulva, prior to ejaculation. This is the third most used method after the pill and condom. So a lot of individuals are using this, and it does afford some effectiveness. Now, it's not perfect effectiveness, but it would be better than a male ejaculating, having orgasm and ejaculating inside the vagina. That's going to be much riskier for unplanned pregnancy. Advantages, doesn't cost anything. You don't need any devices. Men can take responsibility and an active role in helping regulate fertility. That is for a lot of women, that idea that men are in charge of this is very risky for them. And so a lot of women don't want to rely on that. And this can be combined with other methods. So let's say they were using condoms and they've used all the condoms, there's no condoms available, then withdrawal might be the option if they're going to have sex in that particular day. Men are not always aware, or men aren't always able to control their orgasm and their ejaculation. So this can happen before he realizes it is happening. It doesn't protect against the pre-ejaculation, which is sometimes called pre-cum. There can at times be sperm in that. Does not protect against sexually transmitted infections, and depends on consistent and correct use. And again, this can be frustrating for a lot of men to be practicing this. It can be frustrating for women. But it affords more effectiveness than not using a withdrawal method. Barrier methods. So barrier methods are true for people who believe that life begins at conception. Oftentimes we'll want to use a barrier method because it absolutely prevents sperm from uniting with egg and creating an embryo. Male condoms, most people are more familiar with a male condom that fits over a penis. Here's the female condom, which I think is sort of atrocious looking. The advantage of the female condom, she can control the condom use and not rely on a male to put on a condom. It also affords across the vulva some exterior. So if there's oral sex, it can afford some protection for women for oral sex. The Today sponge, most women are not using that today. For those of you who are Seinfeld friends, Elaine, for a while, bought the sponge and would use the sponge. You would take this spongy thing and then you would put water in it and you would insert it inside the vagina and it would emit spermicide. And so it was really good protection against pregnancy. The joke that happened for Elaine on Seinfeld is the manufacturer stopped manufacturing the sponge. And so she had a certain supply of the sponge to be used with her boyfriends, but she couldn't buy any more, and that was her form of birth control. So then it became a thing when she would be dating guys, was he sponge worthy? If he was sponge worthy, he was really hot and she was really into him. If he was deemed not to be sponge worthy, she would break up the relationship. The diaphragm, which was really popular in my mother's generation and my generation, is this kind of flexible type of device that you would put spermicide inside. So this is flipped over here. You put spermicide inside, you would squish it, put it up into the vagina. It would fit nicely over the cervix for a woman. A woman would have to be fitted and measured. So smaller women would have a smaller diaphragm, larger women would have a larger diaphragm. And then if she has intercourse, sperm couldn't get up in there. So they couldn't get up into the fallopian tubes. And then there was spermicide in there. So if any little sneaky swimmers got down in there, they would be killed by the spermicide. And then she would, keep in mind, there's kind of this like flexible metal kind of ring around the top. Then she would, after 6 hours post intercourse, she would get in there, pull out the cervical cap, clean it up, dry it out, and it could be used again the next time she had intercourse. The fem cap was this kind of thing that worked like more like based on suction. So it was harder to insert than a diaphragm. A diaphragm, you just kind of squish it and it pops up in there. This, you'd have to go find the cervix and then squish the cap so that it would hold on there based on suction. And that could be worn for a longer amount of time. Again, it would work much better if spermicides were put inside that, in case any of those sneaky swimmers got inside that, they would be killed before they would go and travel up the uterus. Other uses of spermicides, it's going to vary greatly depending on how correctly it is used. No side effects by putting a spermicide inside the vagina. Again, it's going to be better if it is in there in a device, as opposed to if it's just inserted inside the vagina. If spermicides are not going to affect the woman hormonally. Some of these methods don't require partner involvement. The woman can take care of it perfectly on her own. It offers immediate protection. Some of these methods are over the counter. You can just go buy spermicides. It's backup for other forms of contraception. Let's say there was unintended, if there was intercourse that was not expected, a woman could go and insert spermicide in there, hoping that it can help mitigate conception. And it can afford a little bit of a protection against sexually transmitted infections. The problem with it, spermicides can create vaginal irritation. So some women feel like they're itchy and irritated down there. It can give them more vaginal yeast infections. It can give them more urinary tract infections, UTIs. In some situations, there can be struggle, like with the cervical cap or the diaphragm, difficulty in removing those things. And again, if it creates, particularly if it creates irritation and any kind of sores in the vulva or the vagina, it's going to increase likelihood that if there is any sexually transmitted bacteria or viruses there, it can actually create more of a risk because it can more likely travel inside the skin, inside the bloodstream. Other potential disadvantages, female condom can be noisy. Ester, many of you have not heard of this. I don't know a whole lot about this either, but it's a surgery-free permanent birth control method. It's hormone-free. There's no downtime. Women can go home after this is inserted, and it is quite effective. I don't think this is very popular, though. Tubal ligation, or getting a tubal, involves cutting or manually blocking the fallopian tubes. I still remember when my second son was born and he had this huge head. He had this Humpty Dumpty head. I had really jabby, irregular kinds of contractions and pains for him. And I remember the nurse, they wanted to know after he was born if I wanted to have a tubal done, if I wanted to have my tubes tied, and I didn't. I was going to rely on other form of contraception after he was born. But she asked me when I'm in intense labor, and I jokingly said to her, yes, I would like a tubal. I would like a tubal 9 months ago, and the joke was like, I was having pain. It's like, yes, I want it back then to prevent this, that I'm experiencing right now. It is permanent. Some women do have reversals, but they're not very effectively reversed. It's highly effective and acceptable. A lot of women will have tubals after they are done having babies, or they'll have one earlier if they don't want to have any children and they want something that's totally effective. Very quick recovery time. Lack of long-term side effects. It's very cost effective. You don't need the partner to comply. No need to interrupt any love making. And it's private. Some disadvantages, pregnancy afterwards, to reverse it. Some women do have reversals when they decide after they thought they didn't want any more children and they do want more children. It's not effectively reversed though. So some women, even if they try to have it reversed, it doesn't work. All surgical procedures carry some risk. Some women have it done and they regret it because later on they decide they do want children. You need a surgeon, a procedure room, trained assistants to have this done. It's expensive when it's done, high probability of ectopic pregnancy. So there's some risk of that. Doesn't protect against sexually transmitted diseases. Male involvement. I love this quote. What makes you a man is not the ability to have a child. It's the courage to raise one. Of all the rocks upon which we build our lives, we are reminded today that family is the most important, and we are called to recognize and honor how critical every father is to that foundation. And it seems like Barack Obama has been a great dad, and Michelle a great mom. Okay, joke. I can't remember if I took my malaria pill this morning. If I were a girl, I'd be pregnant a lot. So male involvement. Another slogan, wrap it in latex or she's gonna get your paychecks. Another permanent form of sterilization for men would be the vasectomy. I think this is a cute joke. I survived birth and youth through my vagina, and daddy wants to complain about a vasectomy. I know. I laugh too. It is permanent. It can be reversed, but it's the same kind of thing. So the good thing about it, permanent, very cost effective, less risky for a man to have a vasectomy than for a woman to have her tubes tied. It can be done outpatient. It's done under local anesthesia. They'll just put anesthesia and inject it right into the testicles. And here's a testicle here. The vas deferens is being, the teeny tiny little scalpel insertion. Vas is being pulled out and it is cut. And then you can see over here, and then it is either stitched up or they'll do a little cauterization and kind of burn the ends of the vas deferens. The one thing, it's not immediately sterile, because men can have some sperm still in their reproductive tract. And so after a vasectomy, men are asked to use another form of contraception for a while and then create a donation of sperm. So masturbate or do something with their partner and take a collection into this is usually done by a urologist, take that collection in where they will look at it under a microscope and just make sure there are absolutely zero sperm in that ejaculate about, like about a month after the procedure is done. So it's not immediate sterilization. It can take a while. And that is it for contraception. See you, everybody.